Miss Nala. Welcome back. My name is Kivani. I'm glad you were able to go out and get some food for you and your wife. While you were gone, there was a bit of a situation. It is under control now, but your wife has asked me to explain to you what happened. So I was doing an assessment. I was feeling your wife's fundus. At this point, it is supposed to feel firm. It was feeling a little boggy. So then I assessed for bleeding, and it looks like your wife was having some blood loss. She was having what we call postpartum hemorrhage. So what I did was I began to massage the fundus, and I immediately gave her 10 liters of oxygen, and then I administered 2 different medications ordered by the doctor, a pain medication, and then also a medication to help her uterus contract, called Pitocin, also known as oxytocin. And then we inserted a Foley catheter. After doing all of that, I asked her what her pain level was. It did go down, so the pain was decreasing. We took her vitals again. Her blood pressure as well as her fever did go down as well, and the bleeding did stop. Because of the amount of blood loss, we were thinking that we were going to have to do a red blood cell transfusion. She is B negative blood type, so we were going to either administer O negative or B negative blood type. But it looks like that actually wasn't necessary, but we are still keeping an eye on her. We are still monitoring her. I will be checking in on her every 15 minutes to make sure that everything is okay. So this isn't something unusual. This does happen with a lot of patients. Some of the reasons could have been the fact that the baby was what we consider a larger baby. The baby was 9 pounds and 3 ounces. Also, there was the birth was vacuum assisted, which sometimes does cause this kind of effect after. Okay, but your wife is okay now. We did do some tests also. We did estimated blood loss test as well as a hemoglobin and hematocrit test. Did you have any questions for me? Okay, great. So I'll be back to monitor, to check on your wife in about 15 minutes or so, okay? If you have any questions, go ahead and hit the call button and I'll come right over. All right, thank you. Enjoy your lunch now.